Welcome to another lesson by BeWell, shaping the health and care workforce of tomorrow. The BeWell project addresses the need to prepare the health and care workforce for green and digital solutions introduced in the European health and care systems to ensure they can respond to current and future challenges. In this module, we want to address a very important topic in the digitalization of the healthcare and hospital world. We will cover various aspects that will allow you to delve into the basics of managing clinical images through RIS PACS systems in order to understand the essential elements of the system, the necessary resources, and the most critical aspects. The benefits of clinical information system integration are clear, as it offers richer patient information plus increases consistency, accuracy, and availability of information. Clinicians can access and modify the various information which was created and managed in various systems. In the past, the siloed systems would cause issues with redundancy, human error, and slower access to patient information. However, modern advances in integrated systems have alleviated these hassles. Medical facilities using radiology system solutions can rely on a centralized platform to perform the synchronization of data and image management.
Hi. We can start together. Let's go. As a typical scenario, a patient is admitted to the hospital. They must register and an order is entered into the information system. If the patient requires an X-ray, an order is entered and scheduled into the system. After the procedure is performed, the images are stored and can be retrieved, studied, and shared across multiple departments. Radiologists can make diagnoses from X-ray images stored. They can look up a patient's history and share reports stored. Furthermore, they can access other pertinent patient information, such as the patient schedule. This is handled by one uniform system rather than having to access multiple systems, saving time, cost, and resources. All of this is made possible due to the implementation of smart software tools. With a viewer software, radiologists and technicians can securely access and view patient medical images on any device, including a workstation, laptop, tablet, or smartphone. They are able to view the images anytime, from any location, resulting in greater productivity. Increasing diagnostic reading volume while reducing time wasted has proven to have positive impacts on patient care. There are several important advantages, including the reduction in hospital length of stays, reduction of in-hospital deaths, reduction in or prevention of an increase in the cost of healthcare, and optimization of the rates of admittance in emergency departments or other hospitals' long-term care. Clinical information systems have revolutionized the way healthcare information is shared. These systems are integral to the smooth operation of any hospital or medical facility. However, when they are integrated, they promote efficiency, accuracy, and time savings that ultimately lead to better patient care. If you would like to learn more about how these systems work, feel free to continue with this course. An information system, IS, can be defined as the set of information flows managed within an organization. Therefore, it is an internal component, subsystem of an organization that manages, acquires, processes, stores, produces clinically relevant information. HIS, RIS, PACS are some of the clinical information systems present in healthcare organizations, specifically. HIS, Hospital Information System, an integrated set of computer tools used in healthcare to manage the administrative and clinical workflows of a hospital. RIS, Radiology Information System, a system used in radiology to manage the flow of data related to the reporting process. PACS, Picture Archiving and Communication System, a system used for the storage of images acquired from modalities, management of work lists, and access to images from reporting workstations. It is of fundamental importance to highlight the significant features of a IIS PACS system. From a technical standpoint, it is necessary to ensure that client workstations are adequately ergonomic. The architecture of the client structure is appropriate for the site of interest. Network performance supports data traffic without causing transmission delays. Integrations with enterprise systems are properly analyzed. Regarding organizational aspects, it is necessary to ensure that sensitive data is legally protected, privacy, disaster recovery. Workflow analysis is congruent with workflow modeling. Personnel are diligently and continuously trained. Responsibilities are clear to system users. The hardware architecture needs to be custom designed for each context, as it may depend on the number of hospitals, wards involved, their workload, and the backup policies required to maintain service continuity. To achieve typical functions, our IIS PACS system requires various hardware HW and software SW components, which can be classified as follows. Application servers and databases for IIS management. Application servers and databases for PACS management. Imaging systems, devices for acquiring images from different diagnostic modalities. These are primarily represented by acquisition computers or reporting workstations. Archive system, devices for storing diagnostic images on digital media. Display, processing, and printing devices for images, represented by consultation workstations and their peripherals. Software applications, and network infrastructure. The hardware components cover one of the most delicate and critical parts of the entire system. They should be designed and installed in conjunction with careful analysis of volumes and workflows in individual hospital settings, taking into account trends and future needs. The following are the constituent components of a state-of-the-art system. Data center, SEDID, is the core component of the entire infrastructure. All service delivery systems, servers, and data network connections should be located here. The primary hospital network backbone, department connections, and disaster recovery sites should be connected to the data center. Servers, they should contain redundancy mechanisms for hardware components. Automatic backup, load balancing, and clustering mechanisms should be in place to ensure maximum reliability of the machines. The database system should encode information in a standard language, and 2 copies of the data should be maintained. In addition to supporting image retrieval requests, the database system should interface with IIS and is to acquire additional patient information from their respective databases. Storage, archive. The storage devices consist of an archive server, a database system, a disk library, and a communication network, typically with gigabits per second speeds. The archive system is connected to acquisition computers and workstations via this network. Radiological images produced by acquisition or imaging systems are transmitted to the archive server, archived in the storage area, and subsequently sent to workstations upon request. The goal of an archive is to receive, store, record, group, and update all the information it contains. Workstations are dedicated to exam interpretation and image processing using high-resolution monitors. The hardware configuration may vary depending on whether the workstation is for reporting or consultation purposes. Burners. One of the main advantages of using an IIS PACS system is the elimination of film production, making the process filmless. The creation of CDS, carried out by dedicated burners, has replaced films. The figure shows a diagram summarizing the hardware described above. In the image, the applications are depicted in layers as they are modeled on a known workflow. The applications are not standalone but integrate with each other as needed, as shown in the figure with the blue and azure connection lines. In the figure, a diagram is shown summarizing the hardware, client, workstation, modalities, various applications such as film scanners, etc., used to support the aforementioned functions, highlighting the communication standards and connections between the various data transfers. We can note also that specific hardware requirements may vary based on the RIS-PACS vendor and the specific needs of the healthcare facility. Consulting with the system provider or the IT specialist would be beneficial to determine the exact hardware needs for a particular RIS-PACS implementation. In the upcoming lessons, we can delve into the technological aspects of the different parts of the system and provide more detailed information about the hardware requirements and characteristics. We can explore topics such as server specifications, storage options, network configurations, workstation requirements, and backup solutions. This will help you gain a deeper understanding of the technical aspects involved in implementing and maintaining a RIS-PACS system. Modeling the workflow in radiology, thus schematizing and synthesizing the real world with all its facets and variations, is not an easy task and rarely leads to a unique result. A significant effort in this regard has been made within the scope of the Integrating the Healthcare Enterprise (IHE) initiative, which proposes a detailed model represented in the figure. Within this model, various actors are identified, namely the key components of the integrated chain that leads from the physician's request to the execution of diagnostic tests and the production of the report. The workflow begins with the patient entering the healthcare facility and their subsequent registration, which is done through a system or actor generally referred to as ADT, Admission Discharge Transfer, an admission and demographic system. Subsequently, a service or order is requested for the patient, such as an abdominal CT scan, through a hospital-level or inter-hospital system called Order Placer, which roughly corresponds to a CUP, Centro Unico di Prenotazione in the Italian context, a centralized appointment booking center. At this point, the examination is scheduled, i.e., booked, based on the available resources, through an internal department system within radiology called DSS, Department System Scheduler, or more commonly RIS, Radiology Information System. On the specified date, the examination is performed utilizing the capabilities of an actor commonly referred to as diagnostics or modality, example, a CT scanner. The results in terms of diagnostic images produced are then sent to an image archive, known as Image Manager or PACS, Picture Archiving and Communication System, a system for managing and storing images. At this stage, the radiologist will retrieve the diagnostic images based on the initial request and produce a report, which will be stored and delivered to the patient. The reporting process takes place on an actor commonly known as the review station. In this lesson, we delved into the fundamentals of the RIS-PACS system architecture. Let's continue with the upcoming lessons. See you soon.